Hello, I'm Marwan Aburas. The subject of this presentation is ADI-9, focused on the diagnostic imaging of the alveolar bone crest, abbreviated ABC. This anatomical structure, visible on bite-wing and periapical radiographs, holds tremendous diagnostic value. Changes in its height and density or continuity among most important reliable radiographic signs of compromised gingival and periodontal health. This presentation has two key objectives. First, we will discuss the biological understanding of the alveolar bone crest anatomically, an essential structure that it is often overlooked or poorly interpreted. Anatomically, the ABC is a continuation of the lamina dura lining the socket, and situated 1 to 2 millimeters apical to the CEJ, cemento-enamel junction. Radiographically, it appears as a sharp and narrow crest in the anterior zone and a broader, flatter line in the premolar and molars zone. Okay? So, histologically, the ABC is composed of two layers: a thin, dense cortical layer, superficial, supported by deep trabecular bone. So the thickness of the ABC is 0.2 to 1 millimeter, that's all, depending on the region and the health of the surrounding tissue. So physiologically, it plays a protective role. It maintains the integrity of the PDL. It serves as a sensitive, here we go, indicator of both health, oral health, and periodontal health. And the minute it breaks, then you have a problem, and then followed by attachment loss. It can be seen radiographically why the ABC imaging is so important, okay? We're gonna focus on that. Second, we will review the bite-wing and periapical radiographs. I'm gonna go through details about the best way to get the image we need to see to show those radiographically the best. Then I will examine some clinical cases showing horizontal, oblique, and vertical bone loss, okay? And what does that mean to us in terms of perio disease or otherwise? Of course, we're gonna go over cases with bad restorative dentistry, overhang, open margins, and all of that affect our issue because then we have coronal microleakage, all right, causing the problem that we have in causing alveolar ABC loss, both locally and mostly locally. Then we're going to discuss some systemic diseases and how they can also affect the appearance of the ABC because it is, as I said, it's a lamina dura. So whether you are a periodontist, an endodontist, or a general dentist, okay, understanding of this, you know that. I mean, as clinicians, you understand that, all right? But when I'm going to try to put it in the picture of the 10 ADI, it's a continuum we have, okay? We will explore all of that, both biologically and clinically. Let's get in.